Welcome back to another alternative. I'm your host, Deborah Foster. Our topic today is medical massage therapy. Our guest is Dr. Lawton. Dr. Lawton, what are you doing on his shoulder?
Well, Deborah, with medical massage therapy, we do have a very specific group of techniques, and we call the group of techniques a protocol, a treatment protocol. And to begin with, what we want to do is we want to start out by warming the area that we're going to be treating. And in medical massage therapy, when a patient comes in for treatment, they might come in with a problem with their shoulder or their knee or their ankle or what have you. And that's the area that's going to be treated, going to receive the therapy. What I'm doing here is just warming the tissue and preparing it for the deeper soft tissue work that I'm going to perform. And a couple of things that I could point out to you in my technique. One is that if you watch my hands as they work, they're very relaxed. And we call this soft hand technique. We soften our hands and we relax our hands on the body. And we make full contact with our hand on the surface of the body. The other thing that we do is we try to push in a little bit into the tissue, to compress the tissue just a little bit. And we do that about 2 to 3 centimeters into the tissue. And one of the reasons that we do that is we want to stimulate some nerve receptors in the body that are called mechanoreceptors. And if you would, those are the good guys. Those are the receptors that stimulate things about normal conditions in the body and tissue. And what we don't want to do is to stimulate what are called nociceptors, which stimulate pain and sensations of discomfort and soreness and whatnot. So we're just doing this compression, this pressure into the tissue, and we're doing what's called first and second layer soft tissue preparation. Now also with my technique, as I place my hands on the body and I compress into the tissue, you see me using my thumb a lot. And I use the side of my thumb, the edge of my thumb, and that's as opposed to coming in like this and using the tip of the thumb, which can be pretty harmful to the massage therapist's thumb, to the joints in the thumb. The saddle joint up here can become inflamed or arthritic, or the massage therapist might develop carpal tunnel or tennis elbow, and this massage therapist doesn't want to develop problems through the treatment they're trying to do helping other people. So it's really important that you utilize what's called soft hand technique and compress gently into the tissue. And again, what we're looking for here now is a relaxation in the muscle tissue and the soft tissue, a reddening of the skin, which we're getting here. And that begins to tell us that we have warmed the area, and now we're ready to go into deeper levels of treatment.
So the deeper levels of treatment, do you have a name for that as well?
Well, the next step in the protocol would be what we call deep pocket acupressure, deep pocket. And what we do with that is we do a technique that we call folding of tissue. In the position that I have him in now, there's actually, this tissue is stretched out over the edge of the table here. And when it's in that position, it's actually in what we call an eccentric contraction, which means that there's postural tension in the tissue. Now, if a massage therapist puts a patient in this position and attempts to work on them, then what occurs is they're working through unnecessary tension, and they have to use more force and more compression into the tissue than is necessary. So we utilize a technique that we call folding, and to do that, we can take a cylinder like this, or we can take a simple roll of towel, and we can place it underneath the shoulder like this. And don't help me, just make me do all the work here. And you notice how that lifted that, and it relaxes the tissue here. Now when I massage the tissue and work into the tissue, I can go into the tissue very deeply, and I don't have to worry about pushing through that unnecessary tension. So it's more comfortable for the patient, it's easier for me, and I'm not stimulating the pain receptors. I want to stimulate the sensors in the tissue that indicate that things are normal and relaxed, and we have normal movement and whatnot in the tissue. So now, by this folding posture that I've done here, I'm working my way up to going deeper into the tissue. And indeed, what we attempt to do here with the shoulder as an example is what we will attempt to do is to work all the way down to the bone surface and specifically to work the joint capsule and to work where the various ligaments, in this case, the ligaments of the shoulder, what we call the joint complex. And in addition to that, we want to get the tendons of the rotator cuff muscles as well.
So we're going to be working origin, insertion, and the belly. Is that what you...
Well, we work origin, insertion, and we do work the belly of the muscle. And certainly in relaxation massage, there's a lot of working on muscles and working origin, insertion, and a lot of belly massage. And there's a lot of gliding technique that we would call like efferage and petrissage and whatnot, or long gliding stroke technique that we would utilize. But our focus in medical massage is to go to the joint capsule, once again, to the joint capsule, which is where most chronic problems are going to be, not in the muscle belly. And so we want to get down to the origins and the insertion points. We want to work the joint capsule, and we also definitely want to work the ligaments because they're very important structures in chronic pain and the kinds of problems that are progressive problems that lead to arthritis or osteoarthritis or calcification.
Now, what about barriers? Should there be a barrier between the massage therapist and the client?
Well, what we
patient?
do here is called surgical draping. That's something that we utilize in medical massage. I'm just kind of tightening him up here a little bit. And so we have him completely covered in a sheet. And since we're working the shoulder, it's not necessary for him to completely disrobe. And we only expose the area to which we're going to be working through the treatment. Okay. So